I'm really excited to talk about our stroke program. It's a fully accredited stroke program by the Joint Commission. It's a program where we are able to provide comprehensive care to our stroke patients.
This is one of the biggest programs in the Mid-Missouri, and we have a patient who comes to the university. We can give a clotbuster therapy up to 4.5 hours intravenous, and we can also have done clot extraction up to 12 hours with very good outcome.
When the stroke patient comes to our emergency room, we need to have a quick response, and that's where the emergency team comes into place, followed by a quick emergent scanning done where we have to have CT technicians ready, lab results, followed by radiologists reading the scan, stroke neurologists examining the patient, making the decision whether the patient needs the clot-busting medication or not. And if the patient needs an intervention, then you need an interventionalist. If the patient has a hemorrhage and not ischemic stroke, then might need neurosurgical expertise. And once all these big issues are resolved, then the patient needs to be admitted to the ICU, where we need a critical care team taking care of the patient. And once the patient is having all the workup done, then the rehabilitation is started, where we need physical medicine and rehab folks helping us to provide rehab to the patient. So all this is a collaborative effort among multiple subspecialties to provide the best stroke care to our patient.
Time is essential. Time is brain, and that's what we try to tell everybody. So when EMS is activated or a patient comes into the ER with a symptom of a stroke, Code Stroke team is paged out, and we all respond to the code in the emergency department, or even within the hospital if it occurs within the hospital. When we try to see the patient and get treatment, if possible, if it's an option, within 60 minutes. That's multiple tests, pictures of the brain, assessment from the physician, IV access, and the sooner we get it, the better chance and the better outcomes the patient will have.
If someone who is witnessing somebody else having a stroke, they need to understand the importance that there are treatments available now that can be given to a stroke patient within a certain time window, which can actually help the patient, or it can even at times completely resolve the symptoms. And some of these treatments include clot-busting medications and even interventional techniques, but they have to be done within certain time window. So if someone can recognize the other person having a stroke, they can quickly ask for the emergency help, and they can always activate 911, which can always get the patient into the appropriate emergency room in timely fashion.
So stroke is lack of function in part of the body because of a blood clot or bleeding in the brain. The symptoms of the strokes depends upon the part of the brain being affected. It can include a severe headache, loss of vision, weakness on one side including facial droop, imbalance, and slurred speech.
We categorize risk factors into two categories: modifiable and non-modifiable. Non-modifiable is genetics, age, family history.
So if we go by the top 5 risk factors which can be modified, those includes high blood pressure, diabetes, high cholesterol, any abnormal heart condition, and smoking. These are the top 5 risk factors which can be modified, and they are the major risk factor for a stroke.
The stroke is basically blockage of a blood vessel. It could be because a clot came from heart and blocked it. It could be because the arteries have become thickened. So now we are looking at the risk factors that make those arteries harden or thicken at an earlier stage. And one of those is high cholesterol. So we need to make sure that our cholesterol is within normal range. In that context, diet becomes very important. We need to make sure that we do not have high blood pressure. In that context, knowing about obstructive sleep apnea is very, very important. So all these modifiable risk factors that we talked about, they do have a bearing on our blood vessels and therefore make us more prone to having stroke. Same for hypertension, same for diabetes. All of these can affect the blood vessels and make them thickened and hardened to where you become much more prone to having a stroke.
Well, we want the people to be aware of that we are running a full stroke service here, from not only the critical as well as outpatient clinics. So if you are having any risk factors of having a stroke in future, which includes high blood pressure or high cholesterol or smoking, and even your age or any other heart disease. If you are having any of those, then you are at the risk of having a stroke. So that primarily means that you should be aware of the stroke signs and symptoms, and if any time you are experiencing any of those signs, which primarily include difficulty in having speaking suddenly, or difficulty seeing with one eye, or unable to move one arm or one leg, you should immediately call 911 and seek emergency help, because those could be the symptoms of stroke which can be potentially treatable.
We have a fully accredited stroke program which can provide you complete care. You can be certain that if there is a latest treatment available for stroke, that is going to be available to the stroke patient. That's number one. Number two, as you can tell from my personal involvement in many years back, we try to make sure that we're providing the best care to our patients, just like we would want to do for our own families. Number three, that we will be looking in a very comprehensive fashion for all the risk factors, just like we talked about sleep apnea, and we'll also be taking care of those factors that are sometimes left untouched.
So the volume of the patients has increased tremendously over the past 2 years. The outcome based on the hospital stay has shortened. The patient going to the rehab or going home, the proportion of the patient going home has increased. Patient receiving clotbuster therapy within 60 minutes, whoever comes to the hospital and is a candidate, has increased tremendously. So like I can say, we have the shortest clotbuster therapy time of 22 minutes, and average we run like 35 minutes, while the national benchmark for the intravenous clotbuster therapy is like 45 to 50 minutes. So we are ahead of the game.